In the earlier session, we have completed the appointment and registration process, and we have finished the complete registration cycle. So what happened next after the registration? That's the EMR module, that's the electronic medical record, where once the patient is registered, the nurses will be taken over the patient and they will be doing the triage assessment. They will enter the vital signs and hand over the patient to the doctors. So to continue with that particular workflow, we need to go to the EMR module. So this is the EMR module. We go to the EMR, there is EMR workstation. So in the EMR workstation, this will be available for both nurses as well as for the doctors. When the nurses log in, they will be seeing all the patients which are registered under the facility, irrespective of any particular doctor. But when a doctor log in, he can able to see only the patient which are registered under the doctor name. So since this is a nursing account or there is a particular admin account, I can able to see all the patient here. And under the workstation, I can see there are two patients are registered and both the patients are in registered status. So we have a different status here on the top. This is to identify where the patient is right now. So when the patient is doing the checking process, it will show the status as checked in. And once the reception finished the registration process, it will show as registered. After the registration, the next step is the nursing assessment progress and nursing assessment completed. That's when the nurse is taking the triage, and once the nurse has finished it, it will change into nursing assessment completed. Then we have EMR progress and EMR complete. So this is when the doctor started doing the documentation, it will become EMR in progress. And once the doctor finished the documentation, it will be marked as EMR completed. So now the patient is in registered status. So the nurses will be selecting the patient. You can open the patient by clicking on the name. So as you can see here, this is showing a new indication next to the patient name because it's the new patient. And the doctor information, the appointment information, all this will be showing here in the workstation. And if I click on the patient, it will open the patient file. So since it is a new patient, there is no record available on the system. That's why it's directly opening the visit entry page. And for the nurses, we will switch to the nursing form group. So for the nurses, we have different panels or forms to be available for the nurses. And the first form is the vital or the triage assessment form, where the nurses will be entering the basic vital reading. So let me fill up some information. As you can see, the temperature is entered, height and weight is entered. Based on height and weight, the BMI will be calculated here automatically. The blood pressure, SpO2, blood sugar. If the patient is having any pain, you can mark the pain assessment as yes, and you can select the pain score. And if the patient is having any allergy, there are three types of allergy: drug, food, and substance. So based on the type of allergy, the allergy items will be noted down here. So you can select a generic name if it is a drug, and you can select the severity, it's a mild or moderate or high. Yeah, so these are the basic vital information the nurses will be entering, the basic vital parameters, pain assessment, and allergy information. After they have taken the triage or taken the vital, they can mark it as nursing assessment completed and save. So the status of the patient will be changed from registered to nursing assessment completed. So if I go back to the workstation, I can see now the patient is in nursing assessment completed status. Earlier it was in a registered status like this. So once the nurse has finished the documentation, now the next step is the patient will be going to the doctor to see the doctor. So when a doctor log in, he will see the same workstation, but only his patient will be listed on his workstation. So when a doctor log in, he can click on the same patient name, same like how the nurses open the patient. But this time, so there are some information entered in the patient file. So that's why there are one more tab up here that is called visit summary. So visit summary is nothing but a summary of complete documentation that is done for this patient. So here all the visit of all the previous visit which are available for that patient will be showing here in the visit summary. For example, as you can see, this is Today's date is under Dr. George, and these are the information entered as of now. Because the nurses entered only the vital signs, that's why it's only vital signs shown here. Once the doctor finished the documentation, this will show all the information what the doctor has entered in here. So basically, since it is a new patient, doctor will open the patient and see the vital information. So I can see the height and weight. I can go and check on the graphical chart option to see the chart option. Since it's a new patient, there is only one vital is available. So after reviewing the vital, I will go to the visit entry page. So in the visit entry, I have an option. I have a different set of forms. Based on each specialty of the doctor, we can configure a different set of forms like general physician, orthopedic, ophthalmologist, pediatric, different type of specialty. We can create different type of forms. So this is the basic normal GP doctor. So that's why there are some standard forms which are common across all the doctors. So we'll be going through that workflow. The first form is the medical history. So this history is divided into three sections: medical history, family history, and social history. So this is the pretext where the doctor can ask if the patient is having any history. Let's say I have entered a type 2 diabetic, so I can enter the history here. If there is any family social history, I can mention it here. If there is no history, I can mark it as nil. And the next option is the chief complaint. The chief complaint, basically, what is the main complaint of the patient, why the patient arrived here, that will be entered in the chief complaint. So I can type the chief complaint in the doctor's own words, which is having fever since last 2 days. There is an option to make it as a favorite as well. The doctor is dealing with the same type of complaint over and over again. Instead of he typing the information for every patient every time, he can set up this information as a favorite. So if I click on this star favorite icon, I can see there are a lot of favorites are there. So in case if it is the same type of complaint I am receiving it today, I can select that complaint and click on done. So the complaint will be loaded automatically and I can make the modification accordingly. So that is a favorite option that is available for in every places like chip complaint, diagnosis, all the modules we have a favorite option like this. So I have entered the chief complaint. Next is the review of system. So if review of system and physical examination is a similar type of documentation form where we have all the systems that are available, like oral screening, eye, ENT, neck, cardiovascular, respiratory, different type of systems are available. If all the physical examination is normal, they can mark it as normal. And if some of the information is not normal, he can mark it as abnormal and we can enter the notes over here. Here also we have an option to choose a different template. So for example, as you can see here, there is a diabetic template is here. So I click on diabetic template, system will automatically load the diabetic template. So I don't have to type all this information for every patient. I can just choose from the template option. Then we have diagnosis. So diagnosis, we are following the ICD-10 version where the doctor can search with the diagnosis name or the code. So for example, I click on fever, it will search all the fever related diagnosis. And if I type here diabetics, it will show me all the diabetic related diagnosis. I can search either by the name or by the diagnosis code. I can choose it. And the first diagnosis that I added, it will become primary. The second one, it will become secondary. In case if I want to switch it, I can simply drag and drop it on here. It will become primary and this will become secondary. And in case I'm adding any chronic condition, I need to make the status or condition as chronic. If I make it as chronic, this will be added into the problem list so that since it is connected with the different regulatory portal like Malafi, NABID, etc. So once we mark it as chronic, it will be sent the diagnosis as chronic to the Malafi or the regulatory portal so that it can be seen by the other doctor as well. And in case if the doctor wants to enter the diagnosis in his own words rather than choosing from the diagnosis list, because if the doctor is not able to find out the proper diagnosis code, I can enter the diagnosis in my own words. So this is the pretext that's called narrative diagnosis. I can mention my diagnosis in my own words, and it will be available to the insurance coders and everybody. So that is the diagnosis. Then we have services. So after reviewing the problem, doctor need to suggest some investigation, like lab investigation, radiology investigation, etc. So I can order the investigation from here. For example, let's say I want to order one laboratory. I can search the CBC here. I can get the CBC code, or I can search by using the CPT code as well. If I type the CPT code, I can able to see uh, the procedure. So this is a CBC. I click on CBC, it will get added to the patient. Same way, I can order a radiology investigation as well. So if I want to order a chest X-ray single view, I can type the code or by the name. I can search it. I click on this service. And since it is an X-ray, I need to select the laterality. I can either select the left or right or mark it as not applicable and click on right. I click on add option, it will get added to the patient. As since it is an insurance patient, I can see the insurance status. As you can see, this is showing covered because these services are covered under the insurance. This service is showing required prior approval. That's why it's showing PA. So if the service is required approval, it will show prior approval required. Same like in the diagnosis or physical examination where you see the history or favorite option. Here also we have something called order set. So in case if it is a diabetic related patient, I can set up a different setup. I can create a order set like whatever the services that I have added right now. Instead of adding it every time, I can go to the order set. I can select the order set and there is a diabetic group is there. I can select it and click to add to visit. So it will automatically get added or ordered for the patient. And instead of it will reduce the time for the doctors to add and search for a service. Instead of that, I can create my own favorite option. And finally, we have a prescription where I have, if I want to prescribe any medication, I can prescribe from here. Same like diagnostic service, here we have an option to search by the name or by the generic name or brand name or chemical composition. So for example, if I type here Panadol, it will show me all the Panadol related paracetamol or Panadol related medications. I can select which medicine and the dosage, let's say 3 times a day for 7 days. So the total quantity will be calculated here. Say 1 tab 3 times a day for 7 days. So total quantity is 71. And the instruction will be picked up here to take 1 tab 3 times a day for 7 days. I can click on add and the medicine will be added here. Same like if I want to add additional medication, I can do the same process. Same like services, we have an order set option here. Instead of doctor is adding the medication every time, I can create a group here and I can add all the medication. Whenever I wanted, I just select which group and click on add to visit. It will add all the medication into the patient prescription. So that is also possible. So these are all the basic forms that is used by the doctor. And as I mentioned earlier, we have different type of forms for different type of specialty. Like dental have their own form, orthopedic have their own form. So that can be configured. So in this demo, I'm just covering the basic forms only. So once I have finished the complete documentation, I can click on save. And after saving, there is a complete option. I can make it as complete. Once it is complete, the EMR or the patient status will be marked as EMR completed. So that means the doctor has finished the consultation. So after the completion, if I go back to the EMR workstation, I can see the patient is now changed to EMR complete. It means EMR is completed. And I can now see the next patient. So these are the basic option. Now, if I open the completed patient again, I can see in the visit summary the complete information that I have entered. So you can see there is a vital, this is the complaint, this is the history, this is the examination, diagnosis, the services, the prescription, everything. So whatever I have entered, it will show here in a summary option so that the doctor can able to summarize what are the information that I have entered. And there is a medical report icon. If I click on the medical report, it will open the medical report of the patient where the same information that you are seeing here will be showing as a summary format, like a summary format like this, where you can see or print the information as a summary or visit report. Yeah. So that's the basic workflow for the EMR.